Hey guys, it's Dr. Kamel. We're going to continue on with our ultrasound series, and today we're going to talk about how you can use an ultrasound to identify the Lisfranc joint. Now, I know what you're thinking. Ultrasound for Lisfranc? Why not use a CT or an MRI or a radiograph? Well, I'm going to show you how you can use an ultrasound to make a quick and easy diagnosis of a ligamental injury of the Lisfranc joint that oftentimes go misdiagnosed or are not seen on a radiograph. Recently, there has been a trend for using a primary fusion for purely ligamental injuries in the Lisfranc joint. I'll refer to the classic article by Coetzee, which is a prospective randomized controlled trial, where he showed that primary fusion had better short and medium-term outcomes than that of an RIF. Now, I'm not here to talk to you so much about the debate between a fusion or an RIF, but rather to emphasize that there is debate for purely ligamental injuries that you can use an ultrasound to make the diagnosis for. Alright guys, now I'm going to show you how you can use an ultrasound to identify the Lisfranc complex. What we're looking for is the dorsal Lisfranc ligament, because we're not able to see the interosseous or the plantar Lisfranc ligament because bone will reflect the sound back and you will not be able to see the ligaments, the interosseous and the plantar. So here's a system that I like to use to identify the Lisfranc. It's a pretty easy way. So you start right here in the mid-shaft of the first and second metatarsals, and you work your way down so you can see those two bony structures. And then as soon as you see the first metatarsal disappear, so let me go through that again. So you got your two shafts, and then as the first metatarsal disappears, and then you see the cuneiform come into view, and then right there, that's where you can see the ligament. It's a hyperechoic structure. Its thickness is around 1 millimeter, 0.9 to 1.2, but average 1 millimeter. And sometimes, depending on how much fat is there, you'll see that it might be slightly hypoechoic, but generally speaking, it's hyperechoic. And what you're looking for with pathology, let's do this again so I can show you. So again, the two structures, first metatarsal base will disappear, and then boom, you have your cuneiform and your second met with the dorsal Lisfranc ligament. Okay, now I'm going to show you guys some images. I know it might be a little bit hard to see here, but I'm going to show you some images that will help to identify the normal and abnormal Lisfranc ligaments. With using the method that I've shown you previously, here is the first view that will come in while you have the probe transversely on the first met and second metatarsal shafts. The ultrasound probe is then moved posteriorly across the first TMTJ and is positioned in the coronal plane transverse to the first cuneiform and the second metatarsal, as you can see here in this image. Note the normal dorsal Lisfranc ligament and the characteristic bone contour or plateau of the first cuneiform at the ligament attachment. You can see here there's also a skeletal model that shows the two transducer positions that I've shown you in the previous two images. Now here you can see an example of the dorsal Lisfranc ligament. The sonographic view is in the coronal plane or transverse view to the metatarsal shaft, and this shows the hypoechoic and swollen dorsal Lisfranc ligament. Note the two arrows from above. You can also see that there is a normal second metatarsal first cuneiform space, as noted by the arrowhead below. Here is an amazing example of the power of an ultrasound. Now you can see there are two images here. The image on the left is a non-weight bearing image, and the second is a weight bearing image. So you can see that the ultrasound on the left shows abnormal hypogenicity because of absence of the dorsal Lisfranc ligament. There's also widening of the Lisfranc joint, and then this one measures around 3.1 millimeters. The second image on the right shows the same patient but in weight bearing. So this dynamic imaging is useful to show that there is actual gapping and widening due to pathology to the Lisfranc ligament. Thank you guys for watching. Hope you learned something. Until next time.